Great. All right. Hello, everyone. Welcome. Delighted to be at this point in the process of the Loyola Health Equity Quest and the final culmination of this program. So I'm Stephen Collins. For those of you I haven't met, welcome to those of you in the room. Welcome to everybody who is online and joining us virtually. We'll say a little bit about Matter, a little bit about the program, and then we'll get right into it. So Matter is a healthcare innovation hub and incubator that we started in 2015 with a mission to accelerate the pace of change of healthcare and a fundamental belief that collaboration is the best way to do that. Functionally, we do three things. We incubate startup companies. We've worked with about 750 companies since we started. They're all over the world. They're every stage of development. They're innovating in every aspect of healthcare that you can probably imagine. They've raised a little more than $4 billion to fuel their growth, and we have a suite of services that help them from just getting started all the way to scaling up their solutions into the market. We are a nexus for the healthcare community, so we really value opportunities to educate, to inspire, to bring people together who are passionate about healthcare innovation and healthcare transformation. And we provide a suite of services to established entities, whether they are insurance companies, health systems, life sciences companies, universities, associations, others who are trying to better harness innovation to advance their goals. We've worked with about 130 organizations since we launched in 2015. Today is the culmination of this program that we've been doing together with Loyola, and the focus is really on the intersection of climate change and health equity. And climate change is no secret, is exacerbating public health challenges, and the effects of this are being felt, of course, by the most vulnerable communities. And so when Loyola came to us to discuss an initiative focused on this intersection, we really embraced the opportunity. We have not focused so much here. It was a really novel way of looking at healthcare challenges in the context of a larger challenge we have around climate, what those intersection points are, and how we can harness innovation to really make a difference. The US healthcare sector itself accounts for about 5% of all global CO2 emissions. We know that climate change is connected to a variety of respiratory diseases, injury, premature death. And again, it's low-income communities, it's the elderly population, it's those with underlying conditions who are the most vulnerable, who are the most effective. So thank you to the team from Loyola, who's been instrumental in putting this all together and working with us in a very collaborative way. We've been delighted with this relationship. Mike Bloom in particular, and Merle Thomas, who have been terrific partners with us. Talk a little bit about Dean Morato in a moment, but I also want to really thank our judges who are here, and they're going to be taking a look at the presentations and providing the questions. And so Tom Lee, who's a serial entrepreneur and a venture acceleration fellow at Matter, and Charvi Badani, who is a venture capitalist with, I feel like I have to say that because the name of her organization doesn't scream venture capital, but this is what she does, the American Family Institute for Corporate and Social Impact. And Eric Hochberg from Horizon Therapeutics, thank you. And Rebecca Sexton from Blue Cross Blue Shield of Illinois, who I believe is joining us virtually. So before we dive into the presentations, I want to welcome Dr. Lane Morato, who's the founding dean of the Parkinson School of Health Sciences and Public Health, who really had the vision for this program and the idea to collaborate in an entrepreneurial way to work with an organization like us. And we're delighted that it is us we've been able to work with. She's trained in epidemiology, board certified in public health, spent time at Procter & Gamble, focusing on developing, commercializing new drugs and indications. She directs Loyola's collaboration with the University of Chicago Rush Institute for Translational Medicine, regularly advises the FDA on issues of pharmaceutical risk management, and again, has been a wonderful partner for us. So thank you very much, and please join me in welcoming.
Thank you.
Dr.
Thank you, Stephen, and welcome everyone. We are excited to be doing this in person this year and virtually. I just think this is really exciting. So yes, I'm the founding dean. Many of you are founders of other types of other groups, and so I embrace the kindred spirit of the challenge in creating things that are new and scaling and trial and error and that constant, spirit of continuous process improvement. And that's why we're so delighted to be partnered with Steve and Matter in general. I think you heard it in his words, that innovation through collaboration. I think of design, I think of scale up and product development as a team sport. And we're excited to be an academic partner in this, working with an established incubator, and that gives us opportunity to work with entrepreneurs such as yourself. Because frankly, we can't address issues of health equity in our society unless we come together and we work across sectors and across disciplines. Because as you know, health is a complex interplay between systemic forces, economic, racism, climate change, but we call it social determinants of health, where people live, how they're educated, access to clean water and clean food. All of these are the upstream determinants that affect access to good quality prevention and care, and affect access to healthcare delivery. So if we are to address the intersection of health equity and rapid climate change, it means we have to be thinking differently. It needs to be that we think out of the box. And that's why we're excited to see all of the teams that are represented here today. At Loyola School, Parkinson School of Health Sciences and Public Health, as a new school, we are also with you in embracing an entrepreneurial energy and a fervent desire or impact to be really affecting health in all dimensions. And for that reason, we're excited that you bring a variety of disciplines and ideas to the table. We hope that this conversation might spur ways. I know last night we were having dinner with some around, I hadn't thought that how water is treated over here or how buildings are built over there are really determinants of health. And that might spark different ways of making connections of value proposition statements and different kinds of target customers as to who we might deliver value to, with really the hope of having a greater societal impact. Because we're all global citizens, whether it's here locally in Chicago, what we do here affects everywhere around the world. And so that's why we're here, to work with Matter, to work with folks like you, to submit forward thinking ideas so that we might create more sustainable healthcare delivery. We might think of ideas and solutions that might be addressing directly climate change, but indirectly, eventually, health of everyone. And so we too very much appreciate the partnership with you, Stephen, and Matter. The team at Matter has been fabulous to work with, Sam, Emma, and Gina. And really it's a chance to reimagine what is the role of universities. We often focus internally on the innovation we create. At the Parkinson School, we want to be sparks and catalysts for the innovation that you are making. And that's by sponsoring events like this that we hope that we catalyze the thinking around the innovation you're doing and ensuring that we're also addressing issues of health equity. You may not realize how we design and develop things might lead to unintended consequences, and who has access to that innovation, who can afford it, how it's sustained. And so if this just gets everyone thinking about health equity and that continuum in a new and different way, that's great. We tend to think about health equity in terms of our characteristics. We might say socio-demographics, age, gender, sex, race, but equity can be where you live. Equity can be health literacy. Equity can be, do you have digital access? How many people are actually buying and purchasing using credit cards? Who has digital access? There's a huge swath of the American population that does not operate through banking. it's through other forms and services. So digital apps may sound great for a certain segment, but are they reaching everyone, right? So that's why we're here. That's why we're excited to have the judges here that embrace this idea of thinking about equity in a broad lens, and why we're excited to hear about the ideas that you have today. And I'm appreciative not just of the Matter team, but I also must remain ever grateful. We wouldn't be here today being able to do this without support from the Parkinson family. They created an innovation fund for exactly this kind of purpose, to be spirits out in community to spark this kind of discussion. And then I'm grateful for the internal work that's done within Loyola and the Parkinson School, those that faculty and staff who served as producers and reviewers to get us here today, mentors, they helped the team along the way, and specifically to Mike Bloom, which you'll hear more from, as well as Marley Thomas, that many of you already interacted. So it takes a team, it takes a village to really do innovation, and I wish you all good luck today. And I hope that it's a good learning process for all. So thank you.
Thank you so much, Dean Murado. So welcome again to those joining us virtually, those in the room. We are going to dive into the presentations in just a second. I wanted to give the judges a chance to introduce themselves. I know Stephen talked a little bit about them, but this can all allow you to put a name to the face. So Rebecca is joining us virtually. Do you want to kick it off with the introductions?
Good morning. Nice to see everyone. I'm Rebecca Sexton. I'm from the Healthcare Services Corporation, or Blue Cross Blue Shield. I work in innovation and I'm a senior design strategist. Good luck today.
Thanks, Rebecca. Charvi?
Hi, everyone. I'm Charvi. I work with the American Family Insurance Institute for Corporate and Social Impact, AmFam Institute for short. We are an early stage investment fund investing in startups all over the US to close equity gaps.
Eric?
Good morning. My name is Eric Hochberg, Associate Director of Energy and Sustainability at Horizon Therapeutics. So happy to be here this morning.
Thanks. And Tom?
Hi, morning, everyone. So Tom Lee, I'm a healthcare entrepreneur, Matter Venture Fellow, and just a very enthusiastic member of the Matter community generally. So thanks for having me here.
Great. Well, we are super excited to start these presentations. So we are going to start with the HeartScreen Health team.
All right. Good morning. My name is Dr. Grace Lynn. I am the CEO and co-founder of HeartScreen Health. I'm an advanced heart failure cardiologist, professor of medicine at Mayo Clinic, and I'm a proud alumnus of the Loyola University Stritch School of Medicine, and it's my privilege to introduce HeartScreen Health. Heart disease is a major public health burden. It accounts for more than 850,000 deaths in the United States, and about 12% of US healthcare expenditure every year, more than any other type of disease. We know that early detection saves lives, but many people live in healthcare deserts and have trouble accessing care. Nowhere is this more evident than in the cardiovascular disease community, because most specialized heart centers are concentrated in metro areas, as you can see on the map. Travel to access these centers increases carbon footprint. And while telemedicine may address some of these healthcare inequities and reduce the environmental cost of access, existing telemedicine tools have limited scope for cardiovascular disease and are primarily focused on rhythm monitoring. Our solution to address this need is HeartScreen Health. HeartScreen is a smartphone-based telemedicine toolkit. Our app captures and transmits a patient's heart sounds using their own smartphone, and it enables cardiologists to remotely screen for heart valve disease, which can lead to heart failure if untreated. HeartScreen effectively modernizes the stethoscope for the telemedicine age. HeartScreen facilitates sustainable, carbon-efficient, specialized cardiovascular care. There's a linear reduction in carbon footprint with distance saved and travel to consultation. A meta-analysis, data shown here, has demonstrated that in-home telemedicine reduces the carbon footprint of travel to consultation by 372 kilograms per carbon dioxide equivalent for consultation. HeartScreen's smartphone app, downloaded onto a patient's smartphone, enables in-home cardiovascular telemedicine. In this way, we provide sustainable, carbon-efficient cardiovascular screening and monitoring by a cardiologist. Let's contrast the traditional method of screening and monitoring for heart disease versus HeartScreen's solution. In the traditional approach, a patient must travel for multiple face-to-face visits with a doctor who listens for heart sound changes. If these changes in heart sounds lead the doctor to suspect heart valve disease, the patient must then travel to a cardiologist, who again listens to heart sounds and decides whether further monitoring is sufficient or if the patient must travel again for specialized confirmatory testing and valve replacement surgery. HeartScreen streamlines this inefficient approach and moves it into the patient's home. Using HeartScreen's unique app, the patient records their own heart sounds on their own smartphone. Our technology filters the sound. It generates a visual sound map called a phonocardiograph and transmits this information to a cardiologist remotely. The cardiologist can then listen to the heart sounds in their office, analyze current and historical data, and make a decision on the next best steps. There are several market forces driving demand for HeartScreen. The first and most important is the large, growing volume of undiagnosed, unmonitored patients at risk. We're only monitoring a fraction of these patients today. For example, we know that 5 million people are diagnosed with heart valve disease each year and require monitoring. But recent population data suggests that up to 50% of the 55 million people over 65 years old in the United States actually have undiagnosed heart valve disease and should be screened and monitored annually, but aren't. This vast underscreening of this at-risk population has become so important to the cardiovascular community that it is the focus of proposed federal legislation before Congress to increase public valve disease awareness and to mandate valve disease screening. The second driver is the growth in the valve replacement market. As more prosthetic devices enter the market, become more durable and available, and the expertise to implant the devices increases, this market is expected to triple in size in the next 10 years. Demand for HeartScreen will explode. We envision a $20 per patient per screen pricing model charged to hospitals with the ability to pass the cost through to a patient. But even if a patient is unwilling or unable to pay for screening, hospitals can still recoup the cost of HeartScreen by shifting away from the more expensive and costly face-to-face traditional screening model to a telemedicine-based model using HeartScreen. Hospitals are further incentivized to use HeartScreen to identify those patients who need more profitable heart valve replacement surgery. But even more importantly, it allows these hospital systems to treat the right patients at the right time. Based on a conservative estimate, capturing even less than 5% of the total market, we believe that with this pricing model, HeartScreen's gross revenue will be in excess of $40 million by year 5. This is our 1-year timeline. We're still in very early phases of product development. We hope to have our heartbeat detection prototype completed by the end of this year. If awarded the prize money, it would be applied towards further software development for more advanced audio filtering and UX development. Even more valuable are the industry connections and contacts that can be provided by Loyola and Matter, which we could use to extend our own network and would vastly accelerate both product development and customer discovery. We have the right team to make HeartScreen a success and to make it the go-to sustainable, carbon-efficient cardiovascular screening and monitoring tool. 4 of the founding members met in the executive MBA program at the University of Chicago, where we were awarded the Global New Ventures Competition first prize for founding HeartScreen. We have experience in medicine, intellectual property and technology law, finance, operations, and sound engineering. Between myself and Dr. Brady, we have over 35 years experience in clinical cardiology and deep connections to this practice community. We know and we understand what physicians need and what they want to improve patient outcomes. On behalf of HeartScreen Health, I thank you for the opportunity to participate in this year's Health Equity Quest, and we look forward to the discussion.
Grace, with that, we have about 7 minutes of Q&A with the judges. Tom, do you want to start us off?
Sure. What are the competitive advantages of your iPhone-based solution as compared to some audio kind of like specialized devices that are now also being used in telemedicine, including Bluetooth connected stethoscope and things like that?
Thanks, Tom. That's a really great question. I'm familiar with that stethoscope. In fact, I've used it myself. The main advantage of HeartScreen is that it can be done with something that the patient already has at home. So HeartScreen's app doesn't require any additional hardware. You don't have to attach anything to the phone. There's nothing to maintain. Basically, it's compatible with the patient's own smartphone. We're developing it for iPhone now, but we'll be developing it for Androids as well. The main difference between something like the stethoscope, and you're probably thinking of EcoHealth and a few other of the kind of market leaders, is that even though it Bluetooths to the phone, you still need both the phone and the stethoscope in order to listen to the heart sound. So to use a digital stethoscope, you'd actually have to send a healthcare worker to the patient's home and then use it, or you'd have to train the patient to use the stethoscope. So the smartphone is really just, it's on its own, it's standalone and doesn't require any additional equipment. There are a couple of other types of telemedicine tools where the stethoscope can be in a remote office, so to speak, and then that can be adapted to use telemedicine. But again, it requires a physical location for the stethoscope and the equipment, and then the medical personnel that teaches the patient how to use it.
And then just one quick follow-up question. When you look at the iPhone, and I assume at some point you'll probably do Android as well, if not already, is there any technological advancement of those two platforms that gives sort of provides like ideal timing, for you to use this app-based approach as opposed to a separate peripheral? Anything, whether it's better audio processor, better microphone, things that would make it more medically kind of medical grade, enable it to be a more medical grade platform than perhaps it has been able to be so far?
So the microphones really across the different types of cell phones are really very similar, and they actually have the ability to pick up frequencies across the range of human heart sounds. Our technology really is in the sound filtering, and our sound engineer couldn't be with us this morning for the presentation, but he's really been able to filter out the extraneous noise and modify the sound, if you will, to make it sound very similar to a stethoscope. I can actually show you what the recording looks like here. So this is a phonocardiograph. These are the heart sounds. So what's labeled there, S1 and S2, are the two components of normal heart sounds. And this appearance is very similar to what the output that you would get from a digital stethoscope. So it's really in that sound filtering process in the software application that we have that competitive advantage. In terms of the ecosystem of the other devices and how this could be used, one of the nice things about the Apple ecosystem in particular is that there are these rhythm monitors that are available. So I think everyone's familiar with the Apple Watch that measures your heart rhythm. And it provides a timing cycle that's very useful to be together with our product. So it's another reason to choose the Apple ecosystem or the iPhone as the first product.
Yeah, thank you. Thanks for your presentation. I have a question around the educational component. So I thought what you said about the, where the market is going in terms of people being undiagnosed and not really knowing exactly what to watch for is really important. So I was thinking from a consumer perspective, is there anything in your app design or in your service that you're offering at all that will help people understand how to basically, is there anything that will help people understand how to watch for certain signs or to monitor their condition, basically to educate them?
Yeah, it's an interesting question, and I'd say there are two parts to it. One is the actual technical use of the device, which we're anticipating in a further build that there'll be some guidance in how you place the device. So again, if you imagine how a doctor moves the stethoscope, there's a little bit of training and education that's required, but that should be built into our app. The second part of it is something that we've really discussed a lot, is how much we want to play in the education of patients and the raising of public awareness, which for me as a cardiologist is probably the most important part. The legislation I mentioned was discussed at the American College of Cardiology legislative conference that I attended last week. And then within our professional societies, there's a big push really to make people aware of this disease, which is really potentially a killer that people aren't aware of. So we've talked about whether we would more actively build into the apps some of these types of educational programs and how strongly we would participate in that type of education. But I think that's a very important component, is that most people don't know what valve disease is, let alone aware of the symptoms that it could cause. And really heart failure is the end result. We want people to be aware of that the screening is necessary. When they're still asymptomatic, they should see a doctor, they should be screened, they should use HeartScreen if it's available.
Great, thank you so much.
Mine is a follow-up to Rebecca's question, which is just to understand a little bit more, who is the target audience right now? Is it people who are already diagnosed to be at some risk of cardiovascular disease, or those who are yet to be diagnosed? And if it's the latter, how do you see yourself reaching them?
We see this as a product that would be prescribed by physicians, so that the physician would recommend to patients that they continue to use HeartScreen. So it requires some education on both sides, but the target population that we want to screen is everybody at risk. So that's everybody over age 65, because those are the people most at risk. So 50% of them probably have some form of valve disease and are completely unaware. Across the entire spectrum of age groups, probably about 2.5% of the total population have some more severe type of valve disease. And then there would be more patients than that, or more people than that, who would be at risk. But our goal, our mandate, and our mission is really to increase that valve awareness and to screen everybody at risk, and then to monitor those patients who are diagnosed. And that monitoring would be done at least on an annual basis. When the patients get more severe disease and it's approaching the time that they need to come in for cardiac imaging and then valve replacement surgery, those patients would be monitored more frequently.
Thank you.
Wonderful job, Grace. Thank you so much. Up next, we have the storm sensor teams.
Okay, good morning, everyone, and thank you for having us. My name is Erin. I worked as a principal scientist at several environmental consulting companies before I founded Storm Sensor in 2015. Storm Sensor works with cities and agencies to track how water moves through our storm systems, sewers, and streets, and we map that movement to climate and socioeconomic data. We focus on climate-related flood risk. At the same time, our solution also empowers communities to address public health issues related to climate change equitably. So while riverine and coastal flooding continue to pose a major threat to communities across the United States, causing billions of dollars of losses every year, urban flooding, which is often neglected in community planning and preparedness, has significant impacts and similar costs. Increased rainfall, combined with rapid land use change and development in flood-prone areas, has amplified the adverse economic and human impacts. The annual cost of flooding in the United States is borne primarily by Black and low-income communities. Racial and ethnic minorities, the elderly, renters, non-native English speakers, and those with mobility challenges are disproportionately affected by floods in each area. In Chicago, for example, 84% of residents experienced stress due to a flooding event, and 87% of flood damage insurance claims were paid in communities of color. And yet, far less than 10% of the flood risk to these homes within these communities is actually covered by insurance. Communities with the least affordable housing, the least discretionary income, are systemically predisposed to being less insured. The poverty rate in flooded areas is higher than that in dry locations. During Hurricane Sandy, for example, nearly 1 out of every 3 flooded census tracts had a poverty rate of 20% or higher. And the health impacts of flooding, especially in these low-income communities, are complex. Waterborne diseases come from contact with sewage and floodwaters, and in many cases, those floodwaters enter our homes and contaminate drinking water sources. Mosquitoes breed in standing water, saltwater intrusion impacts drinking water, which makes it non-potable. And when we're talking about communities that don't have strong social benefit networks to support their residents, when people get sick, they can't get to work or school, they lose their income, and they lose their homes. We have to fix this, and the solutions that we deploy need to be local because each community has its own unique challenges. Storm Sensor offers solutions that are hyperlocal, that emphasize social equity and decision-making, that target high-risk areas first, and that provide the insights that communities need to prioritize, respond, and adapt to flooding. Our surfer maps tell you where a flood's most likely to impact your community, the consequences of flooding, and what to do about it so communities can prioritize flood risk. Our sensor field terrapin dashboard displays real-time data and predictive alerts from storm sensor data networks, as well as other third-party data sources, so communities can respond prior to and during storm events. Our unified data platform provides interactive insights that inform effective deployment of capital to fix these issues, so communities can adapt to climate change. I'll walk you through how this works for Neptune Beach, Florida. Neptune Beach first used our Surfer Index to identify high flood risk areas, which includes high vulnerability to humans and also high hazards, so a lot of the physical risk factors. And then prioritize community actions like education, evacuation plans, and community support. We also identify critical community infrastructure like hospitals and police stations, which are often harder to reach in marginalized communities. As a result, these areas have limited access to resources to prepare and to prepare for and to cope with flooding. The locations above ground are the dots, and the below ground dashes are areas that we monitor in real time. That data is presented on our Terrapin dashboard, and key stakeholders receive notifications of flood events in their towns. Taking it a step further, we then provide insights that really tie that socioeconomic data, the sensor data, and the weather conditions to evaluate system performance and really highlight the areas that require the highest priority fixes to meet community needs. As I mentioned earlier, SURFR prioritizes flood risk, and the resilience component really highlights different strategies that communities can take to address that risk. But we'd like to take this a step further. We'd like to use the grant money from Matter to really drill down and highlight specific resilience actions, for example, based on distance to critical infrastructure like hospitals, for each parcel within a community. We'd like to incorporate heat island impacts, and we'd like your help in identifying additional health-focused tools and actions that we can recommend to the communities and the cities within which we work. Storm Sensor is first to market with inclusive database solutions and a community-focused approach. We're also the only solution in the market that offers a fully integrated turnkey platform that includes operational and strategic response planning and climate risk analysis in one, that incorporates historical, current, and future community and climate conditions, that predicts location-specific system performance and emergency response requirements. And we're the only company with a solution on the market that actively integrates community, namely social equity and inclusion, both of which the IPCC have identified as crucial for communities to consider when reducing the risk of climate impacts. We went to market in 2019. Our average annual contract size has doubled year over year, and we're projected to continue doubling those contracts in the coming years. We anticipate just about $400,000 in revenue in 2022, about $2 million in 2023 based on projects in the pipeline and anticipated to close in the coming months. Our team at Storm Sensor is truly incredible. We have some of the most brilliant data scientists, software engineers, designers, and industry experts in the country working with us because we all share a vision to make a difference in our communities, both at home and across the world. Our leadership team has over 80 years of combined industry and stormwater experience, and each of us has demonstrated an ability to lead teams to do great things. Storm Sensor has demonstrated the need, and we've demonstrated our ability to be the market leader in helping cities and agencies reduce climate-related flood risk by targeting those high-need regions first. The health impacts of flooding, especially in these low-income communities and communities of color, are complex, impacting everything from mental health to disease to losing our homes and our livelihoods. It's something that we have to fix in order to truly adapt to climate change. And while we understand that we are not a typical health company, our solution empowers communities to address public health issues. And we look forward to doing that and doing it better with you. Thank you.
Erin, we now have 7 minutes of Q&A from the judges. Eric, do you want to start us off?
Sure, thank you, Erin, for the presentation. I'm curious, once you deploy your sensor network, how long you typically gather data and analyze before you can determine where are the weak points or stress points that need to be affected?
So there are a couple of things that we can do. When we do the initial analyses using SURFR, we're pulling in static data sets that allow us to map physical risk parameters to socioeconomic risk parameters. As a baseline, we use CDC's social vulnerability indicators, and we also incorporate income and population density. So we can pull that together in a matter in about a week or so with the community. And then as far as the actual sensor data, once those sensors are deployed, we start seeing how these systems function within a few days, if not, within a few weeks, if not days. All we need usually is one storm event that gives us an idea of how these systems are functioning, where the efficiencies are, where those pain points are, and how we can start working with cities to prioritize where to implement those fixes.
Thank you. So it's not, it's I would say a typical storm event that you're looking for, not something that would be an extreme event.
Exactly. You hear in the news how all these flood events are happening because we're having heavier and more severe storms, which is true. But I would say 99% of the flooding that we're mapping within these communities is just during a normal rainfall on Tuesday.
Hi, Erin, Charvi here. Curious to know, as the solution's been deployed, what have been some ways that government officials have used the data to create any upgrades, changes to prevent further such events that happen?
Certainly. So cities like Neptune Beach are posting Surfer on their websites, so their communities can identify where the flood risk is and what those main drivers are, and also what actions they're taking and why. And then as far as the sensor data, cities are using that to optimize maintenance before storm events, so they can make sure that the system is functioning as it should be, as designed. They're able to respond during flood events to close right-of-ways and take some short-term actions. And then cities like Norfolk and Neptune Beach, for example, as well as others, are also implementing retrofits of their infrastructure. In Norfolk, Virginia, they are in the process of completing a $300 million retrofit in a low-income neighborhood, based in large part on the data that we collected that showed significant sea level rise and tidal intrusion all the way into that area that was causing a lot of flooding. And that contradicted the modeling results and analyses that they've done previously. So really understanding what's happening with these systems means that for the first time, we can actually truly fix them.
Thank you.
Hello. Thanks, Erin. Good presentation. I kind of have two questions. One is, what are different, you've kind of alluded to this, but can you tell me more about different data sets that you think would be really valuable to combine to get more and more targeted hyperlocal information?
Absolutely. And Kinga on my team, who's one of our lead data scientists. Kinga, do you want to take that? You're the expert.
Some of the data sets that we're considering to make better health related recommendations for communities are community infrastructure. Right now we have what we call critical infrastructure, like Erin mentioned, hospitals and police stations, but we'd like to identify community infrastructure, those hubs that are very important for marginalized communities to go to during a disaster event. Maybe we'd like to consider heat islands, and that would mean bringing in some kind of tree canopy component. Those are the two examples I'm thinking off the top of my head. We're still exploring this angle and would love your input if you have any.
And on top of that, I mean, with what Kinga was saying, in some of the marginalized communities, some of the main hubs are things like churches and schools, places where people gather on a regular basis. So they know where to go, who to talk to, and also looking at it in different languages. So providing it in multilingual options based on the communities in which these people are living.
Okay, and then just that, I think you're starting to answer the other question I had, which is how do you imagine identifying these communities and the actual people in them that need to be communicated with, and especially since they don't often have data plans on or smartphones.
Totally. So there are a few ways that we do that, or that we've been doing that. I had mentioned earlier in the presentation that every community is unique. So each solution that we implement and develop has to be specific to that area. And the way that we reach those people, obviously we start with city government, we start with concerned citizens and community meetings. And those people have been able to help us reach out to other parts of the community that aren't necessarily as engaged and have that available to them. If we're looking at libraries, we're looking at, we can do different types of literature and postings. There are all kinds of ways that we can do this. And like I said, churches and schools too.
Thank you so much.
Getting excited about.
Thank you.
Yeah, I imagine you've navigated some of the challenges of selling, any kind of thing to a municipality. My question is, in terms of the, let's say, avoided negative outcomes in quantified dollars, in terms of cost savings, by, let's say, automating a previous, manual process, can you give us a sense of what's the type of, return on investment and over what payback period you've been able to deliver so far with your existing customers?
Certainly. We've priced our solution to be relatively affordable to smaller communities, which is different than a lot of our similar competitive companies who are trying to do large sales to large cities. So our pricing's relatively low cost. If you deploy our network and you're able to prevent 2 cars from being disabled in a right of way during a storm, then you've basically paid back that volume or that ROI. Cities like Jersey City are using it to track combined sewer overflows, to map that flooding, to work with neighborhoods, to confirm where the flood risk is happening and where that system's operating. And oftentimes, we've provided the data that allows them to stop a $1 million project that was causing an issue, a pipe over that they didn't expect. And that is, 5x on ROI for that. So it's pretty fast. And what's interesting though, is that the cities that we're working with and the people that we're working with, because it's a relatively, we're looking at for the entire solution, $100,000 to $200,000 for the course of a year, and that's everything. We're working with people who are not super focused on cash ROI. They're more focused on citizen ROI, and making sure that their jobs are being performed more efficiently and people are happy. So it's been a really interesting balance working with investors when they're focused on the cash-based ROI. And we do a lot of that, whereas we're working with some of these people in smaller communities who are focused on how to make their citizens and their people happy, and also their employees.
Thank you.
Great job, Erin.
Thank you.
Super excited to kick it off with our in-person presentation. So I'm going to invite up Sophia from EFC.
Hi everyone, happy to kick off this in-person half. My name is Sophia. I'm the U.S. business developer for EFC. In one sentence, we make compostable batteries enabling low power electronics sustainably. The sensors and electronics help us make better decisions. This is very applicable to stuff like IoT, healthcare, medical, wearable logistics. I'm sure we all know about that. Today, polluting batteries enable them. 15 billion per year of primary batteries are disposed. 97% of emission batteries in landfill are incinerated. It's a huge burden for the environment. They're often hazardous and unsafe, and unfortunately, a lot of underserved and underrepresented communities often have to live around those. These batteries are complex, expensive, and unecological to collect, process, and recycle. So this is the problem that we're tackling at BFC. We make an eco-friendly and sustainable energy solution. I have it right here in my hands. It's like flexible, ultra thin, and lightweight. You can bend it. It's pretty flexible. It's organic. There's no plastic. There's no metal. It's compostable and cost effective. It uses an enzymatic reaction to make electricity. The biofuels are glucose and oxygen, so really stuff that is available around. It's pretty straightforward. It's stacks of paper layers. There's electrical contacts on the end, electrodes, and then a microfluidic layer, which is where we store the glucose, which is patented for us. So it's a bespoke solution. It can take different shapes and sizes depending on what's needed and where it is integrated. So the bigger the battery, the more power and energy. They're series stackable. It's less than a millimeter thick. The next generation is going to be too hair thin to be big, so super thin. Again, it's paper. 20 milligrams weight. Every time that we work on a new generation, we always decrease the weight more. And different ranges of exterior layers available. You can see the one that looks like a long battery. That one is one of our first proof of concept where we integrated into clear blue pregnancy tests. That is what it would look like. So when it comes to IP, we have 6 patents so far, basically at every layer of the battery. 17 more in progress. And yeah, as we enter new markets, we're a French company, so it's great for us as we enter the States and Japan too in our expansion. So this is what it looks like when it decomposes. To know that this is once it's after use, you put it in the compost, or you can literally throw it in your garden. So you can see that it loses 55% of its mass/volume after 45 days once composted, due to its organic nature. Again, it's cellulose and carbon materials. We also have our digital sensing platform, which is what I'm holding right here. It's enabled by a battery at the back, so there's conductive tape, so you tape it at the back. It's ultra low power hardware and optimized firmware, so it's not going to use the battery's lifetime when it's not needed to when it comes to data collection. It's also thin, lightweight, and flexible. It mimics the characteristics of the battery. It is a perfect marriage. We have a wide range of sensors on it. We have temperature, humidity, light, shock, pressure. We have more as we develop new generations. And then we communicate this data wirelessly. We can have the NFC, Bluetooth Low Energy, Loyola, Sigfox, and then represent this on a visual manner, on an audio or a touch. Visual, think about temperature, audio or buzz, or touch to navigate a menu. So we're here to answer sustainable health delivery, especially when it comes to circularity. This is some key points that might help you make a better sense of this. So it's 100 times less emissions to produce a VOC than a button cell, which is what we find commonly right now in all devices. We have 7 contracts so far with 14,500 in asset listed companies, which is representing hundreds of millions of polluting batteries avoided across key industries. So the key industries that we're talking about are healthcare slash wearables. Some great examples could be vital monitoring patch. So think about a disposable patch, you wear it for 7 days, you monitor vitals, and then you dispose of it. But the same thing can be applied to sports and fitness and wellness patches. Adherence monitoring, it's one of the current projects that we're doing. So for example, a pill tablet, recording every time a pill is taken out, so your doctor can know on a remote manner if its patient is taking the medication. Connected diapers, connected hospital bracelets, basically making connection happen in healthcare in a sustainable manner. Medical, we have CGM. Think about diabetes patches are 14 days in your arm, and then you throw them. There's a lithium battery inside of them. Lateral flow assay, wound monitoring, fertility tests. The first example I gave you with Clearblue. Digital catheters, logistics, which also applies to healthcare. Think about cold chain monitoring of vaccines. This is one of the projects that we're currently doing. Blood bag monitoring, all things that are essential to monitor and that are temperature sensitive. Currently, they're not being monitored on a very efficient manner. They're in boxes, and so on the individual unit manner, they're not monitored. So if you can have a label on them to monitor the temperature, that's great. Smart packaging as well. So I have a demo right now. We can show it later. I also have it live, so I can walk around in the Q&A and show you live. So we're moving to industrialization. As of today, we're doing sheet-to-sheet assembly, 1,000 units per day. It's great for prototyping. We're going to move to world-to-world production and reach 1 million units per day in a year or so. This will help us supply the hundreds of millions of units that the current contracts are asking for. We're also growing rapidly. We started in 2020 in France. We received 3 million in seed round. We're now sitting at 1 million in revenue from last year when it comes to joint development agreements, and then 2.5 in unlimited funds. We are going through USA expansion right now and are about to close our Series A. So today we're looking for joint development opportunities. So working with a partner to either replace the current energy solution that they have or innovate together. So Dr. Jules Hammond is our CEO and co-founder. He has a bachelor, master's, and PhD in nanofabricated sensors. Before co-founding BFC, he exited 2 startups. One he sold to Dyson, one to the British Ministry of Defense. Co-founder, Professor Jean-Francis Bloch. He is an international expert of paper, professor, inventor professor around the world, the person when it comes to paper. All managers are all problem solvers. We're 40, 45 in the team at the end of November. Advisory board, people from Becton Dickinson, Thermo Fisher, Avery Dennison, Schneider Electric, and more. All people that have experience in scaling startups, especially in these specific industries. So our headquarters are in Grenoble, France. We have 2 offices there. We also have one in the Research Triangle Park in North Carolina, which is where I'm at. Awards and media, we're proud to have received a bunch of those. We are also nominated for CES 2023 this year, so wish us luck to potentially win it, and a bunch of other great awards and media. So together, power to future nature, this is our slogan. Open to doing a demo right now. I can also play the video for the people online.
Yeah, we now have about 7 minutes of questions from the judges. Tarvi, do you want to start?
Sure, thanks, Sophia. Can you talk a little bit about the production process and what that looks like, especially as a peak of the cost of it and versus the price that you set at?
Wonderful. You have a slide about it. All right, so like we mentioned before, sheet-to-sheet assembly is minutes per day. We're going to move to roll-to-roll printing. This is the machine that looks like. So currently we're competitive with lithium when it comes to pricing, 50 cents. We're going to move down to 8 cents as we're able to scale up and outcompete both lithium and alkaline. Alkaline is 10 cents, so move down to 8 as we're able to scale up.
And all of this production is right now in France?
Yeah, we're
Thank you.
we have plans to also manufacture in the States.
How does the battery life compare to traditional button or?
So the traditional battery has much longer lifetime than ours. The point is that we replace those batteries in use cases that often have either a single use or a really short lifetime. Think about pregnancy tests. That's 5 minutes and it's thrown. Baby dispatches is 14 days. Logistics is 1 to 2 weeks. So our battery usually lasts between 2 to 3 months. Those lithium batteries can last a year, depends. So when it comes to longevity, the current alternative lasts longer. However, when it's integrated to use cases that don't last as much, it doesn't make sense.
Are the budgetary dollars from your customers, your development partners that are funding the purchase of your batteries, how much of that is just from like their main business line as opposed to anything regarding sustainability funds or any kind of strategic sustainability budgets that they may have? Tell us a little bit more about that who's seeking what return on investment. What part of the organization are you selling it to?
Yes, so an easy approach is the sustainability directors, people that promote sustainability within their companies. So they would then talk to their engineering team relevant to the products that we want to do together. Then they would evaluate the feasibility when it comes to the technical aspect, and if that works, I think it's a win-win for everyone. They're avoiding fees and regulations when it comes to using lithium batteries. They're using a product that will be cheaper when it comes to purchasing, as well as getting a competitive edge when it comes to competitors. We do joint development agreements, so companies pay us to develop a bespoke solution. Once the prototype is done and we all agree on it, then they ask X units per year and we supply. That answers your question.
Yes, thank you. Congratulations on great market traction, large contracts. For the use of funds from this particular competition, how would those funds be used and help your expansion into the US?
Yeah, 100%. So we're going to go through, we're in the middle of industrialization, so scaling up is the most pressing challenge for us. We have to be able to deliver. So it would 100% go towards the scale up the manufacturing of all these machinery and stuff. In North Carolina, we also have our main DCS, main supplier for machinery is in North Carolina. So also would go towards manufacturing in the States.
Thank you.
I can play the demo if we have time.
Yeah, let's see it.
Let's move to the virtual. So I can show it here. So that's the digital sensing platform, and that is a back stick. And then this one is NFC, so it would be a tap for your phone. So what happens is that you get the app. And this one is temperature, humidity, and lights in the room. So think about logistics for vaccines. Yeah, just a quick example, and it's every 30 seconds. And so it's going to tell you what's happening in the room. So for those of you here, this is temperature, humidity, and light in a room. Applied to logistics, think about vaccine cold chain every 30 seconds. So right now in France, it's 28 Celsius in the room that they are. It's 57 of humidity in dark. It's we can discover the tag.
Well, thank you so much, Sophia.
Thank you.
All right, up next, we have Aruna Revolution Health, so Rashmi and Lana.
So I was on my period recently and I felt frustrated as I threw yet another plastic pad into the garbage. That was my 18th pad this period alone. Over my lifetime, I'll use up to 15,000 menstrual products, all of which are going to end up in the landfill, and that's just me. In the US, 20 billion menstrual products and their packaging end up in the landfill every single year, taking up to 800 years to degrade into microplastics, which are going to pollute our earth and our water supply. This mountain of waste is the carbon footprint equivalent of 90,000 gasoline cars on the road every single year, and these numbers only continue to grow. In addition, these materials are damaging. Many companies, due to the trend towards sustainable products, many companies are turning to greenwashing instead of responsibly changing their products. Many are claiming biodegradable, which simply means that it can be broken down by microorganisms without the guarantee of an environmentally friendly output. Compostable, however, means that it can turn into useful compost that can be used to regrow plants. In addition, a lot of these materials, such as cotton, are produced through unethical and unsustainable production, which then really puts into question the true value and impact of cotton-based products. And finally, these products, which are in your most vulnerable space on your body, use harsh and harmful chemicals, which are known to cause cancer. Lastly, how accessible are these products? Well, 21 million menstruators here in the US regularly have to decide between period products and groceries. And to my horror, 13 million menstruators regularly resort to unhygienic practices, such as using rags, socks, the list goes on. Without period products, there's a 93% increase in infection rate and a 64% decrease in participation in life, such as attending school or their career, and typically affecting the already marginalized communities and continuing to expand that gender equity gap. Period products are such a necessity. Both Lana and I have experienced and seen these struggles ourselves, which is why we decided that it was time for a revolution. Our company, Aruna, revolutionizes menstrual health management by creating compostable, affordable, and inclusive menstrual products that's made out of local food and crop waste. Why local food and crop waste, you might ask? Well, we saw an opportunity. We provide a cheaper alternative to farmers and food manufacturers to dispose of their waste. Instead of it ending up in the landfill where it would produce millions of tons of greenhouse gases, we redirect it into our sustainable patent pending technology that turns it into Aruna pads. Our process takes in virtually any type of plant-based waste and can turn it into clean and safe fibers to be used for our product. And on top of testing it for the golden standard for menstrual products, we also tested it for compostability. And as you can see, our product did fantastically. The one to the right here is ours, and we tested it compared to our compostable and biodegradable competitors. As you can see, we did well for our very, very first trial with our very first prototype. Aruna outperforms our competitors in a number of different ways, including creating a compostable pad that's compostable both at home and industrially. Using sustainable materials, is affordable, inclusive, accessible, but importantly also has shown strong antimicrobial and thermal regulation properties, which is really important for mitigating things like infection, rashes, and sometimes even fatal toxic shock syndrome. There's a massive market for menstrual products. Globally, Allied Research has shown that in 2020, the market was at $38.9 billion and is expected to grow to $68.7 billion by 2030. Aruna's potential service obtainable market will be $50 million by 2030. In terms of where we're going, right now we're moving from our R&D scale to manufacturing scale. To do that so far, we've done a number of different things. We've talked to the FDA about submission requirements for a class 1 device, all the way up to actually creating and testing our pads. Most importantly, we received a $100,000 grant from the Canadian government for impact food waste reduction. And this has been key to what we've been able to do so far. Moving forward, we're going to start a small scale production that we're going to use to do market trials and product testing. And we're also going to be applying for compostability certification as well as class 1 medical device for the FDA. And with all these results, we'll start a larger scale pad production to launch our pads. So to go to our market, we're going to be starting with social media and educational awareness. We're actually chatting and working with school boards to create a workshop to eradicate stigmas around menstrual health. But also sneakily, we're bringing in brand awareness to our target market, which are teens and preteens. So our early adopters are going to be directed to our website and small retail stores to be able to purchase our pads. We understand the value of the nonwoven that we've created, the compostable nonwoven, and our partnerships. And so we hope to create all of these products and start with menstrual pads, move into diapers for both adults and children, and going on to maternity products and medical wear as well. We know that this is a big challenge that we've taken on, but we're certain we can do this with our team. With my experience as an engineer, bringing multiple medical devices from concept to market, and Lana's experience in menstrual health advocacy and entrepreneurship, we're certain we're the right fit for it. But of course, we haven't done this all by ourselves. We've had a fantastic and diverse team of people that have been able to help us, and also the support and partnership of many others along the way. So we believe that Aruna has the potential to make a massive impact both on the people and the planet. And yeah, we hope you'll join our revolution and help us do this. Thank you. I'll be happy to take questions.
It was a great presentation. I know from my own experiences, commercial composting, they can be very particular about what is allowed and what isn't allowed. Have you gone through any preliminary certifications or like windrow technology, things like that?
Great question. This is actually one of the biggest hurdles that we've faced so far, because we talked to so many people, like a lot of like cities and things like that, trying to understand how composting works. And everyone we chatted with was immediately like, no way, we will never compost menstrual pads. And we realized that it's actually not the cities doing the composting. Composting is actually a private industry, we learned. And so we reached out to Canada's largest waste management company, GFL, and they're super stoked about this. So they've been fantastic. They've actually given us a composting engineer. They've been supporting us in our composting trials. They are, giving us all this advice, and they've really been massively supporting us along the way. And so through this and through getting the compost certification, we can sort of bypass that challenge with composting. And also we've been chatting with the Composting Council of Canada as well as in the States, and learning about, how they would perceive this, and working with them and sort of, I guess, changing the very old-fashioned appearance of menstrual products being unhygienic and showing them that there is a massive value that can be had to this private industry by taking in all of these products for composting.
And just to add quickly, GFL has expanded into the US. So that's part of why we're also expanding too.
Yeah. So they're both in Canada and the
laws here.
Yeah, it's true.
Thank you.
Question. So as a consumer or user of a lot of these products, there are a lot of options in the stores. So curious to know from your customer interviews or people that you've spoken to, what is most important to users of products, and how do you plan to reach them? What type of stores are you targeting, and what is that, go to market?
Yeah, I'll take this. So the most important thing to our menstruators is price. Sustainability doesn't matter if price is not involved. So that's why we've used Food and Crop Waste. One of the reasons is because our pad is way more affordable than all the other pads on the market. So we're also not just trying to target people in cities, but also in rural communities where pads are super expensive. And now our pads can actually be affordable, and they can wear something comfortable and accessible. So that's a major part of it. Now, where we would actually find these menstruators, Cotex did a great study where they looked at who's actually buying pads, and it's the mothers and fathers of teenagers, and they typically stick with those brands for life, except Gen Z and millennial. So yes. So that's why now we're not just targeting the teenagers on TikTok and Instagram, where we follow other brands like Apricot that are, for premenstrual kids and for like prepubescent kids, their first training bras and stuff. So we follow closely other Canadian brands that are very similar to us or doing something similar with the target audience and follow their marketing strategy. And so doing this, we've actually had like a major chain in Canada called London Drugs reach out to us. They're like Walgreens in the US, that kind of version. And other stores reach out to us because they understand the value of that now that Gen Z and Millennial are trying to buy sustainable, as long as the price is there.
And we're able to bring in the price because we're getting paid to take away the material. So it really helps us.
You mentioned FDA Class 1. Can you tell us a little bit about where you're at in that process? Estimated time to get through the process, people you might need to bring onto the team to help you through that, and how critical it is, to get that in order to truly go to market.
Yeah, absolutely. That's a great question. So when we had a chat with them, we learned that, it was a very low class device. In Canada, actually, it's not at all considered a medical device, surprisingly, menstrual pads. So in terms of the process, we have kind of been following the process of a more stricter medical device, just because that's what I've launched in the past, like Class 3 devices. But we learned that we don't actually need to go that far. But we have been chatting with regulatory people. A contractor from Canada that has helped me in the past launch other medical devices. So they will be helping us as well. And so that process includes largely self-registering. For the FDA as a medical device, it doesn't actually require us to do any PMA or 510K. The timeline for that after we submit it is typically between, depending on how busy they are, about like 3 weeks to about 3 months is what they've told us. So we're trying to submit early enough so that we can actually launch in time.
And the other thing too is we have an advisor who worked with Procter & Gamble launching their feminine hygiene line. So he's been instrumental too with the regulatory side.
Great presentation. I wanted to follow up a little bit on the idea of your distribution model, especially since you have talked about rural communities and areas where it might be hard to purchase things. What are you thinking for a distribution model?
Yeah, so in terms of rural communities, Canada and the US are very similar. We both have not-for-profits that allow access to period products in rural communities. So for example, in Canada, there's Free Periods and Moontime Sisters that actively gets these products and then ships them out to rural communities. You guys have the same in the US called Free Periods. And so we've been working with them and chatting with them, like, where is the most need and how can we bring us to you? So we have connections there, which is great. Distribution, again, like we're targeting at first very localized stores like natural health shops, eco shops, and then moving more into bigger stores, which will take time. We want to show the bigger stores like Walgreens and CVS that we have customer traction so that our rental space on the shelf can be lower. So we bring something to the table. So that's why we're starting a bit smaller and then going bigger, because those prices are hefty.
Thank you.
Great, wonderful job, Rashmi and Lana.
Thank you.
All right, up next, we have Xander Cardian.
Thank you very much for the opportunity to be here. So Xander Cardian is a company. We are a group of diverse and experienced teams that is incredibly passionate about radar. And it's interesting that radar as a technology is something that truly is at the intersection of climate change and of healthcare. And so I was thinking about what the problems we're trying to solve, and they really grouped themselves into 3 fundamental areas. The first was really about supporting sustainable care. And particularly one of the statistics that's really incredible right now, we're focusing right now on the long-term care facilities. Almost 60% of long-term care facilities have staffing challenges they describe as severe or critical. So it's a huge challenge. In the end, healthcare, no matter what technology you have, is about people. And if you can't actually get people in place, if you can't really support them, that is fundamentally a challenge to make healthcare work. The second area is really about increasing access to care. And I was at a conference last week, a leading age, large senior care conference, and there was some amazing technology there. But what struck me was almost every single conversation when we said, who is your target audience? It was a very narrow subset. It was people who were a private pay, wealthy seniors in homes paying, $7,000 to $10,000 a month. And very few technologies were actually either priced or able to be rolled out to the broader population. They were really narrowly focused on the most wealthy. And that's a really important thing to think about when we think about technology. And then finally, looking at mitigating climate change. When we go out and look at healthcare facilities, we know, I think Stephen mentioned a statistic about 5%, 4 to 5% of the kind of carbon footprint come from healthcare facilities. Most of those healthcare facilities are older facilities, very difficult to retrofit, in use, they're flying a plane. So to actually think about how we add sort of climate change and environmental goals is really difficult for the facility itself. So we have a very interesting solution because we have this one little sensor right here. And that sensor can actually do two things. This radar is used it sends out pulses and is able to measure your heart rate, your respiration rate, your presence, and your motion. And we're able to collect these vital signs without any staff interaction. So nobody has to wear anything. There are no cameras. The patient doesn't need to do anything. The staff doesn't need to do anything. So it's significant savings in terms of collecting vitals and really identifying patients who potentially are at risk of deterioration. At the same time, that same data can actually feed a thermostat. And actually, if the room is not being used, it can actually lower the temperature. It can turn off the lights. So that same sensor is a medical device that is actually collecting data and helping health, but it's also a facility management tool to actually reduce energy and decrease carbon footprint. So you think about increasing access to care. One of the interesting, this is a complicated slide, I'm not going to go through it in detail, but there are 2 points I really want to pull here. This really enables remote patient monitoring. So if I have a facility in a rural or underserved area, I can actually provide additional clinical support for those patients or those residents in a long-term care facility or in a hospital remotely and make it much easier to collect that information. Also, it's at a cost that fits within Medicare and Medicaid reimbursement. So it's really something that is available to a much broader population. It's not something that is really only going to be targeted to the smallest population. That exists today in terms of that funding model, and our pricing point is low enough that it actually fits there. And they think about mitigating climate change. So bringing it to the US, about 10% of energy usage comes from healthcare facilities. Our experience so far when we've actually implemented these types of technologies to really monitor utilization, monitor presence and motion, we see somewhere between a 10 and 40% savings in utility usage. And that's really significant. You think about, just practically speaking, the price of utilities has just exploded here. In the US, we actually are sheltered a little bit from it, but you go to Europe, you're seeing 30 to 40% increase in utilities, which is coming out of the budget of the facilities themselves, coming out of the money that they would spend on healthcare and delivering health services. So this really kind of brings things together. And I'll just give you one really specific example. And this is Bob. He's an 86-year-old Navy veteran. He lives in a rural nursing home in Iowa. And last month he's part of one of our sites that we have out, and we saw the sensor actually saw a change in his vital signs for no other reason. He had his fall, no injury in that fall. Yet we saw this change. We alerted the facility. They looked at this, and normally they wouldn't have done anything, but they saw that and said, well, why is his vital signs changing? They were actually able to suspect potentially a UTI, a urinary tract infection. They were able to do a test that they wouldn't have done otherwise until it had become much more present. They were able to administer antibiotics, and they estimated they probably had a 1 to 2 day head start from what would normally happen in terms of a progression of the UTI. The hospitalization was avoided for this patient, and he's back at home, or he's at home, and you see his vitals actually go back down to normal. So finally, where are we from a progress perspective? In terms of our healthcare strategy, 2021 was really the foundation for it. We got our FDA approval as a class 2 medical device. We're really working on pilot sites in 2022, really validating both our economic and clinical benefits of the solution. And what we really want to do with this investment and this money is really think about how we build connectivity. We're one piece of a solution. We're not the only solution. So what we really want to do is invest to have a stronger connectivity, data connectivity and sharing with other partners to really make this ecosystem work. And it's both the ecosystem on the healthcare side with electronic medical records and others, but also the ecosystem on the building technology side. So with that, I'm just going to close with a little personal note. really thrilled about this challenge because it's fundamentally different. And Bob Parkinson was a mentor of mine in Baxter for many years. He was my boss, and he was probably one of the most intellectually curious people I've ever met in my career. And I think he would be really excited to see all the different teams and the presentations that come today. So thank you very much and appreciate the time.
Richard, we have about 7 minutes for Q&A. Tom, do you want to kick us off?
Yeah, you talked a little bit about the comparison against, wearables, both in terms of the cost, adoption, signal to noise ratio, ability to differentiate actual events versus false positives. Talk a little bit about the comparison against the competition.
Yeah. So if I think about the wearable competition, I think there are two things. One is just the practical side, particularly with seniors, and the actual capability to wear them, to always wear them, to not put them off and have a battery. So we've seen a lot of resistance. There's been a lot of discussion about wearables, but when you actually go into, for example, long-term care facility, they find it very frustrating to use because either the patient or the resident doesn't want to wear it, or they forget about it. So it sits on the bed, it's not charged, it dies. It's very difficult to implement a remote patient monitoring program depending only on a wearable. On the signal to noise ratio, we are valid, our technology is validated. We actually use a validation to kind of the gold standard with tidal CO2 for our respiratory rate and for an ECG for heart rate. So I think from a comparability point of view, we're generally pretty good. One of the nice things, because we actually have a sense of movement, we actually only collect a resting heart rate and a resting respiration rate. So our sensor, when we see too much movement, actually stops collecting. And so that actually tends to eliminate some of the artifacts that you would see with, say, a traditional ECG, where you see a lot of movement and alarms that come from that. Thank you.
Can you talk a little bit about the go-to-market strategy that you have so far and how you reach the customers in facilities and different places?
Sure. So we actually have a kind of a two-pronged approach. So we're working with either individual long-term care facilities or sort of national operators of long-term care facilities. But then we also work with physician groups, because the way the reimbursement works, it's actually a physician reimbursement for remote patient monitoring. So then we're working with some specialty physician groups who provide that service to the long-term care facilities. So those are our two focuses right now, kind of a two-pronged. Interestingly, a third one in the whole environmental sustainability side is there's also operators owners of the facilities. They're called REITs, who own the majority of facility, long-term care facilities. And they're very interested in the operation of the facility itself, the building. So they've actually become a channel for us to talk about some of the facility and energy savings. And so we can actually bring together the operator who's interested in healthcare and the facility owner, the building owner who's interested in the energy savings.
And in that case, is it two different platforms, ones that cater to the energy savings and the operation side, and one that caters to the healthcare side?
The nice thing is, no, it's one platform. From a technology point of view, once we install this, it does both. Mm-hmm. So we can actually do both. There are different stakeholders, but once you've installed this sensor, it can do either or both at the same time.
So on that side of the world, is it open protocol? Is it easily connected to existing building management system providers?
It is. So we believe that we have the REST APIs. So we're very much an open system. We think there's always work to do in that connectivity, and that's where we see putting this investment to accelerate some of the connectivity. But we do have like BACnet and other kind of building automation systems already in place.
Thank you very much. Hello, everyone, and thank you for letting me be here and joining you today. My name is Jonathan Ostroff, and Fusion Foods is a mission-driven, sustainable meat company that is creating a highly effective gateway product to help wean people from meat consumption for a healthier living and to be on the consumer's terms instead of the company's. As a Loyola MBA alum, it was instilled in me to be better and do better for others. And I am so grateful for this opportunity because I get to combine my passion for cooking towards helping health equity as well as sustainability. And this is a mission-driven and purpose-driven company. And so what we get to do is expand the health and food security of others. And these were my products. So you get to see the tacos as well as the burgers, but there's so many other options that we will explore together. So Fusion Foods mission is coming together as one. Our first main value is health equity, and it's to provide healthy, nutritious, affordable food options for vulnerable communities. Also, we want to use the most sustainably sourced ingredients to help offset what isn't sustainable, specifically beef, and to make this really delicious so that it can be scaled as a win-win product, high in protein and fiber to fit the needs of many. When it comes to diet, doctors for over half a century have been begging their patients to reduce their high cholesterol and high blood pressure. One of the main causes of that, as we know, is red meat. So we see that health and sustainability really matter on what you eat first. In terms of access to healthy foods, where you get at the grocery stores, a lot of that is not always available in and within vulnerable communities. If we're looking at places that we would know, grocery stores that we would normally coin as healthy and sustainably forward, such as Trader Joe's and Whole Foods, there's about 10 of those in the city of Chicago, but only 2 of those exist in the southwest parts of Chicago. So what we would call a health grocery desert in those areas. So the fact that heart disease is the #1 killer in America isn't necessarily the consumer's, inaction, but just available access to these healthier foods and where you can buy them from. So it's saddening to see that. So how do we make healthier options more easily accessible? At the same time, how do we reduce the mass production and consumption of beef that is contributing to the many health and environmental issues? You can see the devastating effects that are being caused by meat production, specifically beef, every single year. What if there was a way to cut this consumption in half? I believe that this is a change worth fighting for. It's a sizable task because the demand for beef remains high year after year, and production of it continues to grow, and the demand for the resources to do so, specifically land and water, are taxing on our environment and our people, and the costs are insurmountable. About half of the US habitable land is being used for livestock. So my goal is to, it aims at weaning, but not cutting beef consumption. But by doing so, we can solve a lot of these issues, and allowing customers to feel a sense of compromise without sacrifice. We will also source our own sustainable beef for my product. These are the 4 big monopolies of the meat production, the beef production. They represent about 80% of all beef that gets produced and sold in the US every single year. Their process is extremely unsustainable, and it creates a lot of water contamination into the watershed, greenhouse gas emissions, methane being most of that. And they really aren't doing that much to change it. So finding more sustainable options is critical. So what I'm introducing is a mycelium product, and this is mycelium. It comes from the mushroom, but it's something that you would normally not see because it normally grows underground. So this product I create is called Faya, and it is amazing, it is magical. The reason is, pound for pound, it has more fiber than oats, more potassium than bananas, more iron than beef, more protein than eggs, a bunch of vitamin A, and it is a closed loop production process. So that mushroom broth that you tasted is actually essentially our byproduct. It is the process of making the finished product. And it is delicious and it's very healthy for you. It's also low in fat, sodium, calories, cholesterol, and this can grow in a scaled vertical farming type of infrastructure anywhere in the world. So why is this going to work? What is the difference between Faya versus what you currently see out there? You may have noticed in recent trends that Beyond and Impossible are not doing very well these days. They're laying off people. McDonald's discontinued the McPlant here in the US. So when I reach into the larger flexitarian market, which is who they were targeting for them, and it's not. It's highly, highly processed, turning a powder into a meaty texture. And the other issues, aside from the fact that it's been processed, is there's a lot of oil and salt and other ingredients that are not very desirable for these healthier consumers. But my product is naturally meaty in texture, so similar to mushrooms that you would normally buy in the store. So it doesn't actually have to go through any of those processes. And because I combine it with meat, it doesn't need binding agents. It is a very simplistic and natural ingredient. And I received a lot of great feedback from people that are runners and health conscious individuals that really like this idea about a compromise without sacrifice. The other very important thing is the fact that people have different wants, different cultural type of cuisines that they're used to, and they don't want to change that. And I'm not asking them to. What I'm asking them to do is use a better ingredient that is better for them. So this can be used in a number of products because most cultures have some form of ground meat in their diet. Now, how are we going to do this? So we really want to start with building brand recognition and growing locally through restaurants here in Chicago, farmers markets, as well as local grocery stores themselves. And by doing this, we can expand eventually to a direct-to-consumer market, utilizing the social branding and content that was initiated from phase 1. This will be able to reach a lot of these personal chefs, families, and fitness gurus who are online. These people are influencers and are often influenced by what they see online, and they like ideas, creative ideas for cooking, for feeding their families, things that make them feel better if they have allergens or allergic to certain things or diet limitations. So this is a great product for those people as well. It's great for social media. But the larger and third phase is about getting access to a broader audience, and that also includes hospitals and healthcare systems, because this has an incredibly high digestible rate compared to any other meat product that you're going to have because of the fiber that comes in with the mycelium. And so this really helps people that aren't willing to give up meat, but this is that compromise without sacrifice. So how are we going to make this? We're going to start off by creating the mycelium finished product with my special recipe at the local Chicago hatchery here. And then that gets transferred over to a USDA certified co-packer who will mix it all together and package and freeze it so that it has a very long shelf life. Over a year, and then it'll be delivered through local distributors across the city and then outside once we expand. the most important thing is the price. So this is available to everyone. And that is how we're going to expand to local communities. And I can't do this alone. Even though I started this company, I have a very strong network of advisors that continues to grow. And what I'm asking is, with your financial support, we will be able to make this dream become a reality and really make a difference on how we eat and live better lives. Thank you.
Jonathan, thank you for the presentation and the sample as well. Is it a 1-to-1 ratio of ground beef or beef to mushroom?
Yes, for the sake of simplicity, most other people that try to do some sort of ratio will only do 20% of the plant-based because they don't want to make it known. But I have been able to do 50-50 because I really want to stretch out the health element of it. And nobody has been able to do it with mycelium. So I think mycelium is that magical product that, you know, goes beyond the 20% that soy or pea use. But the nice thing is that is just my, you know, simple starting point. Eventually, it'll be to the consumer or to the restaurant how they want to make that ratio. It's really about giving that autonomy because I will be able to provide just the mycelium product in the future.
What kind of end user, end consumer pricing relative to alternatives are you looking at, and how does it relate to your go-to-market strategy? I noticed you know, going to be the, you know, direct to consumer. As we think about some of the underserved communities, you know, they may not have the financial instruments to buy things online. Delivery, logistics are more difficult. How do you think about that whole mix of go-to-market and pricing?
Yes, well, to reach those communities, we would be working with the more local grocery stores and restaurants that they normally have access to. And so being, you know, coming in at a price competitive component just under what the average price of beef is, you know, which is a little bit less than $5. So we're about almost 10% less in price because this is a cheaper product to produce compared to beef. There are companies that produce mycelium at mass scale. They can produce the weight of a cow in 4 days, whereas a cow normally takes 12 months to, you know, to grow. So this is a price competitive product, and by staying small and kind of agile in the beginning, we can, you know, keep our price down. And then with investment, I can actually scale this up to cover a larger audience and improve efficiencies. Right now, I am sourcing from the only B2B seller of mycelium here in the US, but with investment, I will be able to actually create my own production facility for those, you know, to ensure that price competitiveness.
Thanks, Jonathan. Adding on to his question, is a big part of D2C, B2C is just thinking of behavioral change. And telling people that you have to change your consumption habits, and what you eat and what you buy is hard. So curious to know how you're thinking of building that trust with consumers. How do you think of reaching them and addressing some of those core issues?
Yeah, well, I mean, I think the beauty of this product is that they don't have to change because the finished item still tastes essentially like has a perfect parity. And it actually makes you feel better afterwards. It doesn't feel quite as heavy. And I think it also starts with a certain demographic or a certain lifestyle. So people who are more into fitness like that it is lighter on their body. But I think working with restaurants in the beginning and chefs that are more creative and want to try new recipes, and you can get their ideas, their recipes to apply towards the business. And starting with them, but then also to, you know, direct to, you know, using social media where people who are looking for creative ways to make healthier meals for their family, or, you know, for chefs that are, you know, have a strong following on social media. I think that's how you really build the consumer trust, is through like more viral, local type of means. If anybody was wondering, number 4 is the actual wheat one. The rest were all plant-based using beet powder.
Wonderful. Thank you so much, Jonathan.
Thank you.
All Right, up next, we have the Parcel Health team. So Melinda. Good morning, everybody. My name is Melinda. I'm the CEO and co-founder of Parcel Health, and we create sustainable packaging for the healthcare space. So I'm a pharmacist by training, and to really understand how I started this company, we have to take a little step back to 2016. So back in 2016, China stopped accepting a lot of the recyclable materials from the US and Europe. So a lot of it started getting siphoned to other countries around China. And one of the countries that ended up being the recipient of most of the American and European plastic waste is Malaysia. And I grew up in Malaysia, my parents still live there. And there's a landfill just 45 minutes away from my parents' home, just filled with American and European plastic waste. They're meant to go to a recycling facility, but none of them have ever seen a day at a facility like this. And when you think about plastic waste that did stay in the United States, a lot of them get sent to incinerators. There's an incinerator out in Chester City, Pennsylvania, where our business is based, in Pennsylvania, not Chester City. They burn about 200 tons of plastic a day, and residents there have 40% higher rates of asthma than the rest of the country. I looked it up this morning. There's also an incinerator about 4 hours from here in Chicago. It's in a city called Sognet, and residents there have asthma rates 20% higher than the rest of the country. And so I'm standing there in the pharmacy, standing with my orange pill bottle and thinking, you know, I know that about 8 billion of these orange pill bottles are used every single year. They're plastic, they're not recyclable. And just for some context, that's more than 500 Boeing 747 planes in weight. This is just from plastic pill bottles, just from the US consumption that's not recycled and going to low-income communities. So knowing that there's so much plastic waste in this space, I had to take a step back and think, you know, is this really even serving patients in the first place? I've seen firsthand patients struggle with opening it. You know, it's really hard to open. The push down and twist is really hard motion for elderly with arthritis. It's really hard to organize. You try to put it all together, they tip over, messes up all sorts of organization that you have. And they're really hard to understand. The labels are small, the font is small, how to take it, when to take it, the side effects are hard to read. Think about the last time you had an orange pill bottle. Did you read the label closely? Did you pay attention to the warnings that they were trying to provide you? And so if you think about it, plastic pill bottles are really more than just packaging you receive in the mail and you just toss it out. It's really a mode of health literacy. And really made me think, you know, why are we giving so little thought to such an important component of healthcare, and why are we creating so much plastic waste from it? Luckily, I wasn't the only one that had this in mind. I met my co-founder, Mallory Barrett. She's an industrial designer, and we had met because she had created a reusable medication packaging. We started working together, and we truly dreamed of a new sustainable future for the pharmaceutical space. And so after 30 prototype versions, we came up with the fill box. The fill box is designed with a toddler resistant lock, which I'll show you in a second. It is made with thick and food safe paper, and it has a trade secret proprietary blend that allows it to be water resistant. And so here's a video, which hopefully plays. Yes, so this is the orange pill bottle. You're all familiar with it. It's hard to unscrew and open. And this is the fill box. You tug on it, it won't open, but you gotta press a button to unlock it, and the pills come out. They're really easy to store, it's easy to reach, it has a flat surface, just makes everything much easier. And this is the current competitive landscape. On the left, you see the fill box. We're water resistant. We're designed to be child resistant, but we're still pending certification from third-party certifiers. Early data has come back for toddlers under the age of 4, and it's performed really well, keeping them out of it. It is easy to use for the elderly. We surveyed individuals above the age of 65, and 8 out of 10 of them prefer using the fill box compared to the orange pill bottles. Recyclable, compostable, and price-wise, we're extremely competitive against plastic, because if you think about it, there's only one other material other than plastic that can rival the price of plastic, and that's paper. And I'm more than happy to go into the different products and their characteristics. In terms of impact, just from the manufacturing perspective, if we switched over
all orange pill bottles into our fill box, we will be emitting 880 million kilograms less CO2 equivalent emissions a year. And shipping wise, these come to us completely flat, and then in the final assembly, we then put it up together. And so we are able to reduce shipping and carbon emissions from there. In terms of end of life cycle, more than 65% of paper are recycled in the United States. So there's no need for incineration or landfilling. It is also able to be composted in the backyard. I compost these myself. They compost within 3 months in a regular backyard environment. As I mentioned earlier, elderly patients prefer our product. And in terms of comprehension, it is a larger surface area. It's much easier to read. And as a pharmacist, I really like that I'm able to scribble little notes at the bottom if there's something that I wanted my patients to really pay attention to. Here are some testimonials. One of the director at a chain pharmacy called this a tectonic shift in the medication packaging space. He has been searching for a solution for the past 10 years, and this is the first one that he's seen that it's viable. Pharmacists out in Michigan gave us great feedback about patients really liking the ease of use and no more plastic. She tried out the product for just a month, and she placed an order for 1,000 units to be carried at her pharmacy. And at the bottom is a patient out in Utah who sent us an email to let us know that she loves our packaging. It's holds a lot of her medications. She loves the square shape. It's really easy to organize. And here's our market size. So the total addressable market for primary prescription packaging, but this excludes, inhalers, this includes injectables, is $33 billion globally. Specifically for the serviceable obtainable market, we anticipate this to be about $6 billion. And the way we narrowed this down is US primary prescription packaging and any prescription packaging that's consumer facing. So over-the-counter medications, orange plastic pill bottles, and any direct-to-consumer pharmacies. We currently have identified that independent pharmacies as our beachhead market. So we're currently available in 22 independent pharmacies. We love working with them. And we're working with these other markets as well in my traction slide, which I will show. So we've received funding, $225,000 from Accelerator, grants, micro VCs. We have a filed provisional patent with the USPTO and PCT. Product adoption, I've mentioned, we are in 22 pharmacies now. We are early revenue generating. And in terms of growth, we have signed NDA with 2 large chain pharmacies. And in my appendix slide, I also have some fun examples. And recently won the Gold Award for a medicine packaging award in Switzerland. In terms of winning the, thank you. So I will just skip right through.
All right, we have time for about 7 minutes of questions.
When you think about both, magnifying the, environmental benefits, and simultaneously expanding to like other types of healthcare medical packaging, what might that roadmap look like for you beyond, just for pills?
Yeah, so right now we're really focused on pills just because a lot of pharmaceutical products are oral solid doses. And so in my appendix slide, these are coming out next week. They are Christmas holiday themes. We really wanted to create sort of excitement around taking your medications. A lot of patients forget to take their medications during the holiday season. Schedule changes. But this is an OTC product that we're working with a pharmaceutical company with. I blurred out the brand name. But this would be an over-the-counter product for an allergy medication. So that's part of our roadmap, sort of starting with independent pharmacies, working with large chain pharmacies, but large chain pharmacy sales cycles are much longer, as you can imagine. And so in between getting there, we're looking to partner with pharmaceutical companies and also direct-to-consumer pharmacies.
And your early pharmacy pilots, these independent pharmacies, what kind of pricing have you been able to successfully test in relation to their alternatives, the pricing of the alternatives?
Yes, great question. So the great thing about independent pharmacies is that they do currently pay a higher price point compared to chain pharmacies. So they pay between 30 cents up to 80 cents for the orange pill bottles. We sell this on average at 40 cents, depending on the volume that they order at. So we're right smack in the middle in terms of pricing. And with the nice thing about the holiday season is we found that they were much more willing to pay at a much higher price point. So we were selling these at 50 cents per unit, and they're willing for it.
Thank you.
Yeah, hi. Thank you so much for your presentation. This kind of makes me think of things like the Nespresso coffee maker, but it's making me in terms of like the service aspect. So I'm wondering if you have talked to any of these pharmacies or companies you're working with about like working with them to recycle.
Yeah, absolutely. I think with this product, it is recyclable within just your municipal, you can put it in your recycling bin and you can compost it. So we do encourage consumers to just at the end of their month, when they're done with it, they can just recycle it. And actually, one of the chain pharmacies that we've spoken to that talked about price point, going back and forth about price point, and they said that the one thing they often have to take into consideration is that the orange pill bottles, wanting to recollect the orange plastic pill bottles to recycle, if they account for that cost, is extremely high. And so even though our product currently is more expensive, but when you compare them needing to take up the end of life cycle for the orange pill bottle, this becomes very competitive.
Okay. And then my other question is, are you using like water-based inks, or what kind of inks are you using on the packaging?
Yes, water-based aqueous coating for the product. We don't make the labels, so the labels are still just what the pharmacy currently uses. And it's compatible with all pharmacy labels.
Okay, thank you.
And then what makes it waterproof? Is there a plastic coating or lining or?
No, so it's a coating that it's a proprietary trade secret coating. It's water-based that prevents water from entering. It's also slightly grease resistant, but does not have PFAS in it to make it easy to tear your label off.
Okay. And have you pursued any certifications for commercial composting?
Yeah, so we're looking to do that next. So part of the being able to so we're fundraising right now, and so being able to obtain the third-party certification for compostability is really important to us. Being able to obtain the third-party certifications with the Arthritis Foundation for their ease of use commendation is really important to us, just because this is much easier for patients with arthritis. They don't have to push down and twist. It's just a push up, press, pull down. And the toddler resistant is like the kids will pull first and press and it won't open. It has a wider length, so kids have a hard time wrapping their hands around.
How's it been working with the smaller pharmacies versus the larger ones? What have been some of the learnings and sales cycles that you're seeing?
Yeah, so with the independent pharmacies, it's been for them, their biggest concern was whether or not we're going to impact their workflow. And so with our pilot program, found that there was no impact to their workflow, which was great. So then that allowed us to sort of shut off the pilot program and turn into paid only. So pharmacies have to purchase to use them now. It's pretty straightforward. We currently just sell them on our website, B2B. Pharmacies place an order, we deliver it, very simple. In terms of chain pharmacies, the big questions we constantly get is how we would fit into their automation machines. And so trying to talk to them about that, we're talking to automation partners as well, trying to figure out how we can retrofit their machines. But in our conversations with these large chain pharmacies, we're really saying, hey, let's take a step, like slow down, like let's try it out in like 2 to 3 pharmacies in like your more boutique locations where you have patients who be really interested in something like this. And if you see large demand there, we can then start to talk about retrofitting your machines to fit this.
So essentially this is assembled at the pharmacy after it's been delivered.
This one currently? Yeah. So currently we have it fully assembled with the top open. Yeah, but so that's really interesting point, because a lot of independent pharmacies we've spoken to, at first they're like, I don't want to change anything about my workflow. And so this has the top open for that. But then once they start using this product, they're like, hey, actually, can you just send it to me flat? Like, I don't mind putting it together because that's going to save me so much space and storage.
All right, well, thank you so much, Melinda. All right, and last up, we have Tatal Filters with Triata.
All right, so I'm gonna take a wild guess and say that most of the people in this room took a shower before coming, or perhaps you cooked with water last night for your dinner, or maybe you brewed a coffee this morning. Either way, we all know water is crucial and it's very important. If any of you guys have checked the news recently, every other month, some city is facing infrastructure failure. Recently, that was Mississippi. And Mississippi was all over the headlines because they faced 2 disasters at once. First, they had infrastructure failure, and on top of that, they had river flooding. And Jackson's main water system facility collapsed, which led to 7 whole weeks of no clean water. And that meant bacterial and lead contamination. And yes, right now there is no requirement to boil from the city, but many residents are still facing brown waters from their tap. So the problem really isn't solved. But why? Why is this happening? 150,000. That is roughly the Black population in the city. That is 80% of the city of Jackson. On top of that, a quarter of the population is actually living under poverty. The water crisis in America is whether or not we want to admit it, a socioeconomic and racial issue. That's just the truth. And it's important that we understand that this is just not a Mississippi problem. It's not just a South problem. This is happening everywhere. It's happening in Detroit, it's happening in LA, Pittsburgh, and hey, Chicago's no different. Southern and Western provinces of Chicago are pretty bad. So let's zoom out a bit. 1 in 3 Americans. That is the population that is dealing with contaminated tap water. On top of that, 40% of Americans are living in places with very, very poor rating for air pollution. In fact, let's zoom out even further. On a worldwide scale, 1 in 6 deaths are due directly to water or air contamination. But what if all these secondary illnesses, water contamination, air pollution could all be approached using a holistic matter, right? What if these solutions, what if the real solution was found in the connectivity amongst these problems, not their differences? Ladies and gentlemen, my name is Thea, and I am the founder of Tikal Filters. And we make water filters, and we make it using agricultural waste, and specifically to target America's infrastructure failure. Not only do we take out an array of contaminants, but we are the first closed circle water filter on the market with an in-house recycling program. Our first product to launch is Tikal Pro. These reusable water bottles come with a compostable cartridge, which is actually this top one, which is FDA clearance for the material. On top of that, we also have a biochar-based filter media made out of rice husks, which can be replaced every month, and our ultrafiltration membrane, which needs to be replaced every 3 months. The complete system takes out an array of contaminants, which can be found on the screen. But these contaminants do face an immediate threat to all individuals, but it's even more to those with chronic diseases, dialysis patients, immunocompromised individuals, or even babies who drink formula. Like, let's not forget our toddlers, right? The end of a catastrophic water crisis also means the start of years' worth of mental illnesses. Unfortunately, neurological problems are not uncommon for those after facing a water crisis of this sort. On top of that, you have high levels of PTSD rates. For example, many locals in the Jackson area already didn't trust their water, and now a disaster like this has left them with even higher levels of PTSD rates. So this additional psychological strain was not necessary, and yet this is a reality facing many. So it was important when we were designing this, right? Like when we were approaching this problem, we had to take in ease of integration. How easily can our solution be integrated into their lifestyles, which is so important but often ignored when the topic of disaster resiliency is talked about. So when we started Tikal, we understood that yes, environmental and green tech innovation trends are so popular, so hip, all the investors want to invest in it, but who's often ignored are the ones who are most vulnerable. Strengthening communities and mitigating future risks was at the very basic needed to be done on a grassroots level. And it was so very important. So we were like, all right, let's take a 4-pronged approach. And this is how we are solving rapid climate change through a health equity lens. Our social enterprise was created to prioritize the decrease of daily and infrastructure related plastic consumption. We also decrease public health disparities due specifically socioeconomic disparities and barriers. We aid supply chain concerns while easing disaster resiliency related storage loads. And most importantly, we also decrease agricultural waste. Now, I am nothing without my team. Few of the members are in the back, but our team is full of engineers, activists, researchers, and yes, startup enthusiasts. So we did come together to basically create a solution for the community that was designed by the community. We're very happy to announce that these very focused efforts did lead to 2 contracts with Habitat for Humanity. One in Flint, Michigan, which obviously, as many of you know, was a big area of water infrastructure failure. And the other one here in Rockford, Illinois, which is less common, but has one of the worst PFAS and lead contamination in the country. So, cool, we're addressing water, right? But what if we could take that a step further? What if, in addition to clean water addressing, we could also target air quality or even landfill population. So that's exactly what we did. And we presented a closed circle lifestyle for our filter media. Our filter media is entirely safe to discard in landfills as it does not leak any chemicals, but it also serves as the optimal base for green construction, specifically our patent pending plaster material. This can be put outside of buildings, as well as its amazing traits of being antibacterial, as well as acting as an electrosmog shield, while also being a continuous carbon sink for the entirety of the material being on the wall. So just to recap really quickly, both filter medias can be sent back to us, right? And we will take care of everything. We will compost the top, the bottom will be recycled, and the inside filter media will then be turned into plaster for high-risk communities. All right, let's talk competition. Everyone wants to know, are we competing against Brita? Unfortunately, we are not. Now, most of our competitors can be divided into 3 different categories. You have your established contractors, you have middle-class options, and you have your environmentally friendly options. Based on our analysis and our approach, we kind of condense it to basically 5 main competitors. The issue is that none of these competitors are really going after the B2B sector, which is where we specialize. We understand that the D2C sector for water filters is quite saturated and that there are many options that just don't transfer over to infrastructure failure, whether that's high cost, supply chain concerns. So yes, that's our partners, and this is what we would do with the funding. Thank you so much.
All right, time for questions.
When the B2B play, is it for the foreseeable future, the entire water bottle, including the filter? Is it a, you know, like a razor blade type model? You basically give away the bottle and then you
Yes.
charge the filter? Yeah.
Yeah,
Okay,
so
tell me about that.
let me start off with, okay, so right here, we do have a razor blade. You hit the nail on the head. We are mainly doing B2B. We are going to be exploring D2C sectors within the next quarter or so. But yes, we are targeting NGOs, community centers, local community, as well as government slightly, but mainly NGOs that are sponsored by governments. A lot of NGOs do get their grants from local governments. On top of that, these are the services that we do offer to our B2B sectors. So not only do we offer the entire water bottle, so at an upfront cost with the filters, $27, it's cheaper than all of our competitors. Our refillable packages, which is where the razor blade comes in, is at $25 for 3 months worth of supplies. And that includes both filters. And lastly, we've talked to enough NGOs that they're like, hey, we want a little more, we want more support from you guys, which is where our services come in, which includes case studies, because that's how a lot of these NGOs get funding when they pilot such programs, as well as water testing, which is all done in-house, and data mapping, which is something that we hope to launch this upcoming year. Mapping and finding out where source contamination is happening, so we can track that and ensure that those contaminants are dealt with properly.
And in those municipal sales, like how often is it that, you know, you're displacing a competitor, tapping into an existing budget as opposed to the buyer having to create an additional, you know, sustainability, more sustainably sensitive budget? How much of it is a replacement versus, you know, going after a new budget that's been created for this purpose?
Yeah, so it's most of the budget that it is pre-existing. So most people are like, oh, you know, we'll use a Brita or we use LifeStraw. In the case of Mississippi, LifeStraw was the biggest contractor from the city. So the budget usually does exist. Disaster resiliency is becoming more prominent, so more people are trying to act on that. So it's about 70-30. But we've actually seen a great interest in individuals who want to start a program. They want to get into disaster resiliency, don't know how to start, which is where if we take care of everything, we will set up the program, we will find your participants, we'll interview them, we'll make sure you have the data pre, during, and post, so then you can start funding more programs that are disaster resiliency based. So that's where the 30% comes in.
Thank you.
Yeah.
Curious to understand, what are the geographies that you're targeting and what's been the process of working with them? Because it is, you know, you're going into each place, building new contracts, building new, support from the ground. So how's that been working?
Yeah, so we understand that, yes, the stat is 1 in 3 Americans have really poor tap water, right? But if I was to come here and be like, yes, I want to target all 109 million Americans at once, it just wouldn't be realistic. So we have cities of focus, mainly states of focus. So one is Illinois, we have Indiana, the rest are listed, Texas, Florida, New Jersey, Pennsylvania. All of these were done based on our initial study and research. So we did over 200 customer discovery interviews. Most of them were with NGOs, organizations, community leaders, and we deemed that first, ease of integration. Are they interested in such a program? Are they also facing infrastructure failure right now? So can we address an immediate problem? Yes. Our bottles can come in, we're addressing an immediate problem. On top of that, can we then work with the community to create a long-term plan on how we can address infrastructure failure? So these were the states that fit the fastest. There were also ones that were most interested in helping us grow with the community rather than just being an immediate solution.
And can you elaborate more on the infrastructure issues that you think you will be able to solve with this product?
So lead contamination is a big one. I'm sure you've heard. Illinois is infamous for its lead contamination. We are the highest in the nation. So unfortunately, that is lead contamination can lead to other. So infrastructure overall is piping, right? Chicago, great water when it leaves the source, but there's a lot of point contamination that happens along the way. Lead contamination is one of them. So we want to address point contamination, which point contamination, which basically targets the chemicals that are listed here at the bottom. So we want to make sure that all these chemicals that do have all these negative ramifications, which this is all preventable, right? This is nothing that needs a large system. It's just that people either don't know that's in their water, or unfortunately, like in the case of Michigan with Flint, or in the case of Mississippi, the government will lie. East Chicago had a very big controversy about this, where the government just got sued earlier this year because they lied to their residents and hid the fact that their water was contaminated. So we just want to give the consumer the rights to protect themselves and their families if the government doesn't want to step in right away.
On the green construction side, you already have a partnership or in place that will produce the.
So we're actually doing all that in-house right now. We are lucky enough to have at Loyola University, we have a lab in the environmental science building. And we're also going to have additional labs in the University of Illinois. So all of that is being done in-house and at M-Hub for all of my Chicago folks. And once we scale up a little more, our first pilot for that specific plaster material should be next summer. So assuming we get the feedback that we need, any changes, then we can scale up with the final formula.
All right. First off, I want to start by thanking all of 8 of our amazing finalists in their presentations. So another round of applause for everyone. And in addition, I want to thank our judges, those in the room, and Rebecca, who couldn't join us in person, unfortunately. But thank you so much for your questions and engagement with the team. I'm actually going to dismiss you all now, so you can go ahead and stand up and follow Gina to do your deliberation. For those tuning in virtually, those in the room, we actually have a great discussion for you. So we are going to invite up Dr. Mike Bloom and Alicia Ponce from AP Monarch to talk a little bit about Alicia's work here in Chicago.
These were really amazing presentations, pitches, right? The intersection of sustainability and public health, and health equity. The variety is unbelievable, because as I was watching each of you, oh yeah, this is great. This has to be the finalist. And then I hear the next person, oh, this is great. It's just quite unbelievable. And so one of the key things in anything that's dealing with innovation is being able to see, right? See where there's a problem, and come up with really novel solutions. And you could see again with this health equity quest, the variety of problems that the entrepreneurs were dealing with and the solutions that they're coming up with. So we wanted to give you also a different view, a different industry, and to see some really creative, innovative work. So Alicia, I'd like to join us. And what struck me, so Alicia is founder and principal of AP Monarch, designing healthy environments. What fascinated me is on the website, so on every page in the footer, it's our philosophy, and I'm going to read you this. As architects, we believe that everyone has the right to a healthy environment. We design your health and well-being in mind for economically, environmentally, and socially feasible projects. So I think I got that right.
Yes.
So my question to you is, can you tell us more about yourself and your background and this important work that you do at AP Monarch?
I'm happy to. I started AP Monarch 15 years ago, and really on a mission to design healthy buildings and equitable communities. The AP Monarch, the name is AP, my initials, Alicia Ponce, and Monarch has a couple of meanings behind it. One, the monarch butterfly represents a healthy environment. So anywhere you go, that there's clean water, clean air, and it just makes people happy, right? No matter your age. And the monarch butterfly also is an ode to my family. My family is from Michoacan, Mexico, and when I grew up, I was born and raised in Chicago. But our summers were spent, a lot of our summers were spent in Mexico, in Morelia. And near there, this is the state where the monarch butterflies migrate to once a year, back and forth from Canada and to Mexico. If you haven't been there to the sanctuaries, I highly recommend it because it is a truly magical place. So, and the monarch butterfly also represents this. It's a beautiful insect, very delicate, that travels thousands of miles, a very resilient insect that makes its journey over generations. So with architecture as a child, I knew that I wanted to be an architect. I just knew that I wanted to build things. And it just naturally connected with my curiosity and respect for nature. So that's where AP Monarch comes from. Where I grew up also brings in the environmental justice, equity aspect. I grew up on the Southwest side, and I just, a short story of I grew up running track in high school. But our high school track was surrounded by industrial sites. And so who knows what we were breathing in that time while we were winning the 100-meter hurdles, I should add. So all of that, fast forward during my journey in architecture and learning about just the building itself, you learn that equity needs to be a part of it. Our health is a part of it, and how do buildings and spaces impact people's experiences, because we are in buildings 98% of our lives, So what does that mean?
That's excellent. You talk about designing healthy environments. So what makes an environment healthy or unhealthy?
Well, it's, if you want to go from the inside out or outside in, it's air quality, right? How we filter our air, especially, being after COVID and spending so much time indoors. Air quality sort of resurfaced at a much bigger pace in the design and construction industry. How well are we filtering our air? And then how products are made. We have certifications for materials that are selected. Just looking around here, when we specify materials, do they have a certain environmental product declaration or a health product declaration? You learn a ton of acronyms, as I'm sure in the health industry you do too. So you look at the air quality, the comfort, and then the operations of a building, something so massive as a merchandise mart. You can imagine how much energy consumption it takes to operate so that we are warm or comfortable. So that's carbon emissions, right? Here in Chicago, globally, 40% of carbon emissions come from buildings. In Chicago, it's 70%. So how do we reduce that? So it's building science, looking at how for new construction, how do we orient our buildings to use the energy that rises every morning and sets every night, right? So it's free energy. How can we use it? And then it's taking each layer by layer of how the building is built, product manufacturers, and then looking at the impacts of how it affects us, our health.
Can you give us an example of sort of specific projects that you've worked on? I know you have different sort of services, and I saw that in your portfolio you've done work, design work for the Field Museum, for example. But can you give us an example of a project that you're proud of in terms of creating that healthy environment?
Yes, so we do architectural services, we are sustainability consultants, and then we do community engagement. There is a project that was complete in 2019 for the University of Chicago, the Keller Center, Harris School of Public Policy, where we were the primary sustainability consultant for that project, and it has won various awards on the green building industry because it went through a certification called the Living Building Challenge. And this certification it was inspired by a flower and its resiliency in place. And the certification goes through 7 petals. The petal that we pursued, you can go all 7 petals, which includes energy, water, and materials and others. But the one that we pursued was a materials petal, and that means that every single material that went into that project was vetted for toxins. There are ingredients that are called the red list ingredients that are just not allowed, right? Because they're not good for you. So it was a huge endeavor, one in which the whole project team was just, all in. And that's what makes a project a success. And so during construction, for example, you typically wear masks because, everybody can think about the smell of paint and all of the adhesives, but for this project, you can walk around mask-free and not breathe in any of those toxins.
That's great. From an economic perspective, in terms of as you're pitching, let's say I am the Wile E. Coyote architecture firm, and I'm trying to bid for a project, and I'm not doing any of these sort of the approach to green architecture, right? Sustainability, healthy environments that you have. I'm cheaper, right? How does it work in terms of the economic argument, the business argument that you may make when you're pitching?
Well, we like to look at the life cycle of the project. What are your utility bills? That's one angle, right? What are your utility bills or operations over the life cycle? You may want to, it may cost you less to pay for a less sustainable project, but in the long run, it'll still be much higher because your operational costs will be a lot higher. But if you invest in, looking at how do you size your mechanical system, for example, to be the right size that it should be, along with the appropriate layers for walls and roofs and all of that building science, then you will get the savings in the long run. We want to go, in the building industry, we want to go to net zero, carbon neutral. Right, so we need to continue to bring carbon emissions down. That's where I came from. Right before here, I was at another conference called FIAS, Passive House for Illinois, Passive House Institute US, that's what it is. And we're all talking about how to bring emissions down from housing to multifamily to commercial, existing buildings, and there's amazing things happening in the city right now.
That's great. One of the values that you mentioned, or the core activities that you do at AP Monarch, is community engagement. Can you talk a little bit about your approach to community engagement, why that's so important?
So community engagement was sort of just dropped in our lap, when a client called and said, you do community engagement, right? And I said, well, we haven't done that. But it just kind of naturally made sense where we have started to work with agencies, city agencies, governmental agencies, and other planning firms, other larger architecture firms. And we go and we speak with, we are the bridge between community and the planning agency because, and oftentimes this is even an added plus because we are bilingual, we all speak Spanish, we're fluent in Spanish. So when planning is happening in a Spanish speaking community, we can speak Spanish, we can speak architecture, we can speak green building and all of that. So it's been a really great journey to work in community engagement because in historically marginalized, disenfranchised, disinvested communities, people are not engaged and the air quality is poor and things just get built and people wonder why weren't they engaged? So it's been a really a game changer for us.
That's great. It's sort of, key in terms of, as we talk about health equity and from a university, from a research perspective, to involve community at the very start of the research work, so that community members aren't acted upon or subjects, but they're partners in terms of trying to figure out solutions to the problems and even identify the problems that they face. So that's really wonderful. I was sort of like biting my tongue as I was listening to your presentations because I wanted to ask questions. And what about this? And the judges, there was limited time. So I want to open this up to all of you. If you have questions, any questions to ask, Alicia.
I think it's so fascinating to see how health and architecture are related. It's something I've never thought about before, but I'm curious how you think about like the health integration as it changes from demographic to demographic. Like, does that change?
Yeah, I mean, the air quality is huge. If you look at, maps that are out there, you see, what the communities that have a high percentage of asthma or, Parkinson's disease and all of that, it's because of the air quality. You see what else is going on around there. So it's very much connected.
What has been your favorite project to work on so far? And like with regards to sustainability?
Well, we have our first international project in Mexico. And this is a project that is, it will be constructed of ramped earth. And so we are literally using the soil from the site, and it can be constructed with machines or it can be constructed with people. So we are opting to construct it with people, with the youth of the town. And so you literally you build the forms and you dump the soil in there, right? The earth, and you have to pack it. So there's just this rod, and then you just pack it. And then you do it every 7-inch layers. So at the end, it's just, it just makes sense. And our client was all for it. And that way the youth would be, at the end of the day, they'll see something that they helped build. It uses very, little to no energy. It cools in the hot days. It heats in the, in the warmer or in the colder days. And that's been a really exciting project to be working on right now.
I'm wondering your thoughts, not just the physical health, but also mental health. I know there's a lot of advances in terms of materials, light, sound, textures, as it relates to people's mental health, anxiety and such. What's on the horizon in that area?
Oh, well, there's so many fun things and so many strategies that are out there, for lighting, for example, and there's the term that we use is biophilic, right? That means, natural light, textures, shapes, all of that definitely impacts a person's mood, a person's mental health, how you learn and how fast you heal. So all of that, we just have a lot of fun with that.
We know that in terms of hospital design, et cetera, that it's really close attention that's being paid there. Not necessarily in sustainable ways necessarily, but particularly in terms of to make patients feel comfortable and improve their healing actually in different environments.
Diet is also now incorporated into the designs that we do, anytime that we can. This is introduced with something called the WELL certification. How well are you? And so they get into the food that is served at the organization that you work at. So how healthy is the food? How many portions are you having? Or what is it? So all of that is monitored.
What you see, it's so interesting from the startups this morning, the finalists, from talking here, how everything is interdependent in terms of creating both sustainability and healing our world and healing our bodies and our minds and our souls, how it's all integrated. From an academic perspective, it's all about sort of that you can't solve problems through one discipline, that you have to work across disciplines. You have to work across schools and colleges, and that's something that I know that the Parkin School of Health Sciences and Public Health is devoted to, and our Center for Health Innovation and Entrepreneurship, to be that nexus, to be that place. That's why we're here. That's why Dean Murato had wanted to do this health equity quest and these competitions, so that we're partnering with Matter, we're partnering with industry, and we're trying to do this all together, looking from multiple perspectives. Any last questions for Alicia?
So many of the buildings are already built. What comments do you have about retrofitting and transitioning existing architecture versus the net new, where you've got all this ability to start from scratch?
Well, that's something that those of us in the building industry, construction industry are talking about right now. There's so much existing building stock, and I was talking last night to about the Inflation Reduction Act. The IRA has it's a federal tax credit and rebates that will be available next year for retrofits, and the intention is to start. Well, you can't say just start with existing, new construct, start everywhere. So there's money allotted for many sectors, from transportation, electricity, envelope of a building, and yeah, so a lot. But that's where we're headed, because we need to meet our 2030 targets, 2050 targets to reduce carbon emissions.
That's great. Well, thank you all. Thank you, Alicia.
Alicia, thank you so much for telling us a little bit more.
Good afternoon, everyone. So welcome back after lunch. I think I have one of the most fun spots, if you will, of this afternoon. And so we are beyond excited that everyone can join here today, and really incredibly grateful to the Parkinson family and the Parkinson Innovation Fund that through Loyola that we're able to support these type of innovative adventures, shall we say. And so, do I have a drum roll? We have finalists, and we had to obviously narrow it down. And so I won't keep anyone waiting, but our first place winner is Parcel Help. That prize money is at $35,000. So congratulations to you and your team.
Thank you so much.
Place we have Storm Sensor at $25,000.
Yay, thank you. This is so exciting.
Congratulations to your team. And then definitely number 3, we have Aruna Revolution Health at $15,000. I'm so glad that I was not a judge, because I'm pretty sure there was some difficult conversations and decisions to be made, but congratulations to all the teams who put in a lot of hard work and all your team effort. Thank you.
All right, well, thank you again to all the amazing startups who pitched today, to our amazing judges who participated, everyone who tuned in virtually and in person. Thank you so much.